Awesome. Super excited to be here with you today, Dr. Jibraj. I know you're the founder of Anacapa Dental Art Institute, one of the premier and top cosmetic and implant dentistry institutes, not only in Southern California, but in the country. So I'm excited to talk about your journey, some of your philosophies about marketing, sales, and just your overall basically focus on customer service. So I'm not going to get into all your bio, but I will say a couple things. I know you were actually born in Kenya, which is pretty interesting. Lived in London for years. Pretty much grew up in London, England for years. I know you're an award-winning. Not only are you in cosmetic and implant dentistry, but particularly though prosthodontics, which I'll have you touch base in just a minute. You were voted in 2007 Best of USA by your colleagues. You're also the author of over 24 articles in restorative and implant dentistry, according to the British Dental Association. 2 books right in front of you here, so the author of 2 books. And you also, I know that you've mentored over about 20,000 dentists across the world. So USC grad, I know not only completed your training in prosthodontics, but also I found out in medical science, which is pretty interesting. So I want to hear a little bit about that. But let me hand it over to you because I can go on and on about your bio. Talk a little bit about what you're doing at Anacapa, just your overall background, and then we'll dive deep.
All right. So yeah, pleasure to be here and to share some of our experiences. I came to the Oxnard area in 2006. And I had a specific vision in mind where I would build a practice which is not like a regular dental practice. I think we're both aware that most people don't like going to the dentist. And my vision was to create something where they'd be comfortable walking in, but also they'd be greeted by somebody who has empathy, who genuinely cares about their experience. When you go to most medical practices or dental practices, it's a very cold kind of reception. And, I've been to many, I visited many, and, we wanted to change that. So 2006, we had a small practice in the Morgan Stanley Tower. And everybody told me, don't go to Oxnard. You'll never be able to realize your vision in Oxnard. It's never going to happen. You need to go to Newport Beach. You need to go to Beverly Hills. It's not going to happen here. And when somebody tells me that, it makes me more determined to accomplish it. So when I came to Oxnard...
For those who are audience, for those of you who don't know, Oxnard is kind of on the outskirts of LA, Ventura County, not totally well known. Newport is one of the top zip codes in the country, right? Yep. So just to give them a little context for those of you who aren't in Southern California.
So Oxnard is relatively a small town, Ventura, beach community. And I started in 2006 and we bought a small dental practice. We had 2 front office and 2 back office. And it was a struggle. And at times I thought to myself, did I make the right decision? I bought the practice and I'd stepped down as chairman of restorative at USC School of Dentistry, which was quite a prestigious position. Mm-hmm. And I traded that to go into private practice. Mm-hmm. So for the first few months when things didn't go so well, I thought to myself, have I made the right decision here? But I always believe that you have to stick to your philosophy. You've got to stick to your principles. And even when things are not going well, you got to keep at your vision. Mm-hmm. And you've got to, almost visualize your future as if it's already happened. And I had a clear idea of what type of practice I wanted to run, what I wanted it to look like, what type of experience the patient would have. And in 2000, and we've been here now 12 years in this particular practice. And if I was to rewind and somebody asked me to describe my practice, this is what I would describe. And sometimes people say, be careful what you wish for, but this is what I wish for, and it came true. And it's not just a matter of stopping there. It's always about how can you innovate? How can you develop? How can you get better? What other things can you do to make the patient experience better? So most of our philosophy, the way we treat patients is centered around having them have an amazing experience, and dental treatment is a side thing.
Right, right. Yeah, one of the things, and we're going to dive deep into all of everything Anacapa, which you're about, and we'll start from the beginning in just a sec. But one of the things I noticed about you, not only about you and then Anacapa, which is a reflection of your vision, I think of two words: world class, right? Not only a world-class vision, but world-class customer service, world-class just essence when you walk in here. And what I've noticed about the successful entrepreneurs that I've been around is they have that trait. All of them, they want to be the best at what they do. And I mean, you embody that tremendously. So let's go back, because we're gonna go through the timeline. But I want to go back to something I read about you. It was that your initial dream was to become a neurosurgeon. Is that correct?
Correct.
Talk a little bit about that. Okay, how that changed over time. But it all starts with a dream, right?
So this may sound quite sad, but when I was a kid, I wasn't really playing with toys and cars and stuff like that. I used to read a lot. Mm-hmm. Science was my calling. I wanted to do something in the medical field, and when I was 12, 13, and 14. I used to actually draw pictures of brains and, really try and find out about human anatomy and how it functioned. And my friends were like, well, what are you doing? Like, why don't you come out on your bike and let's go out for a ride? And I used to do other things, and I really wanted to be a neurosurgeon. I applied
This was in London at the time, London. Right? Okay.
I had applied to medical school, and in medical school, I got in, and that was going to be it. I was going to go to medical school, specialty training, and essentially go along the paths of a neurosurgeon. Now, last minute, I changed my mind, because the road to becoming a neurosurgeon and to becoming a great neurosurgeon was going to be at least 20, 25 years. And in UK at the time, for a consultant, to become a consultant neurosurgeon, somebody had to step down, and not many people are stepping down. So you could work for 20, 25 years and still be mid-level in a hospital setting. And in the UK, there's a socialized healthcare system. So last minute, I changed my mind. I remember it was the end of the summer, and I asked my brother to call some dental schools to see if there'd be an interview. And I got an interview in Manchester, which is in the north of England. And I was the last guy to be interviewed at 4 p.m. on a Friday afternoon. And I was doing my part-time summer job. I got on a bus at the time, 300 miles to Manchester, and didn't look back. That was it.
Wow. And what was it, you talked to your brother, what was it about the dentistry kind of field that caught your interest?
So as far as dental...
Because you could have done a ton of different things in healthcare.
As far as dentistry is concerned, one, the science aspect appealed to me. Two, the people aspect appealed to me. And three, the business aspect appealed to me. So it's a combination of three things. And on top of all of those things, you're able to pick and choose your hours. Right. I love what I do, but I also love living. And I love visiting places, meeting people. So I come into work with a passion, but I also live with a passion, because we only get, one shot at it.
Right. And you have a wife and 2 kids, correct?
I do. Light of my life, my wife, she supported me all the way through dental school, through specialty training. I probably wouldn't be here without her. And I have 2 wonderful kids, Sarah and Zane, daughter 21, son is 18.
Great. So at the point that you got into the University of Manchester, correct, in dental school, you completed that degree. Okay, that sparked that path. Then talk about the path from England to the United States here in the U.S.
All right, so
and what led to that? Because that's a huge change.
huge. So I went to private practice
Okay.
in the UK. And in the UK, once again, it was a socialized healthcare system. So everything that we learned in dental school, we weren't really applying in private practice. I was fortunate that I got to work in some amazing practices. However, when I came across something complex, I didn't feel I had the skills to be able to do it. And I didn't want to be one of those guys who goes on a weekend course, learns how to do something, and starts practicing on patients on Monday. And unfortunately, our profession is like that. If you have a dental license, you can do pretty much anything you want. But in my opinion, I wanted to be trained well. So there's only two countries that I was going to go to and two universities that I looked at. One was in Switzerland, and I couldn't speak German. And the other one was USC. And USC, for my specific discipline, was regarded as one of the best in the world.
Prosthodontics.
In terms of prosthodontics. Yeah. And the who's who in prosthodontics had been through that program. And never in my wildest dreams did I think that I would, be granted a position at the school. I came to LA for an interview. It was a 2-day process. Met the faculty, met some of the students, and everybody's telling me that, listen, you can have no life for 3 years. Be ready. I said, no, this is what I want to do. And fortunately, I got in, and they were absolutely right. Prosthodontics is a discipline where we specialize in implants, cosmetic dentistry, fabricating dentures, treating patients who need extensive dental treatment. And the residency was a hard 3 years. And when I tell you it was 6-7 days a week, I used to be in the lab at probably 5:30 a.m. in the morning, get home about 9 p.m., have quick dinner with my wife. 10 o'clock, I'm in my study, like room studying and reading literature for the next day. I sleep at, 1:30, and literally I have 3-4 hours of sleep. I'm back at it the next day.
Wow.
The day I walked out of the lab, the prosthodontic lab, there was a huge weight off my shoulders because I thought, I can start living again.
Right.
As hard as it was, I can tell you they were the best years of my life in terms of the knowledge, the people I came across, the friends I made. Today we have a global, network where I can visit pretty much anywhere in the world and know somebody and, visit with them and have a nice experience. So prosthodontics changed the way I think, the way I do things. The attention to detail that is needed permeates into everything you do.
That's amazing. And, I know, they always talking about just in the career space, the entrepreneur space, your network is super important, right? And so being able to transition all the way from Manchester to Southern California, which is a whole, basically world in itself, right? And be exposed to USC and the network there. I mean, that's probably done wonders for your career. For sure. At any time you could shift and pivot, obviously God bless this is Anacapa is going great, but you can shift and pivot with that network. So talk a little bit about that network, how that's kind of helped you throughout your journey.
So I'm going to say when I was at USC, I graduated from prosthodontics in 2002. And in 2003, the head of department of fixed and operative dentistry stepped down. And they had a global search. I was a young buck in those days. And I thought, let me apply and see what happens. For some reason, they gave me the job. So I was chairman of fixed prosthodontics and operative dentistry, responsible for over 700 students and 100 faculty. And we had to run the department. And just that position opened many doors for me. I made many friends, and to this day, I'd say that was a turning point for me. I'm still at USC on a part-time basis. I still love to teach. We have private teaching institutes also. So I wear many different hats. Anacapa is definitely one of them. Private practice is a different challenge to academics. And teaching is also a different challenge. because when you teach something, you really have to know it very, very well. But not just know it well, you have to be able to explain it in a very simple, easy to understand manner.
Sure, sure. I think the practice as an entrepreneur, being able to run your private practice, be an entrepreneur, I mean, the value that you bring when you go back and teach there, I'm sure is immense to all the students there, right? Because all of them are very academically trained, right? But as you know, running a business is a whole different ballgame, right? Two different skill sets.
No, it is. And I'm going to tell you this. A lot of people say you don't do in private practice what you learn about. And I'd say that's not entirely correct.
Mm-hmm.
I'm going to say that when you're in private practice, you learn how to make the compromises that are necessary without jeopardizing the outcome.
Mm-hmm.
Right? So there are certain things that you may do differently, but the principles still remain the same.
Right.
One of my instructors once told me that the true character of a person comes out when you see what they do when nobody's watching. And when you're at dental school, when you're in residency, your instructor's going to come and check your work. When you're in private practice, you're checking your own work. So I still see my instructors on my shoulders every time I do a procedure. What would they say? What would they say? Have I done it to the best of my ability? Private practice requires great skills in people management, not just from a patient perspective, but also from a team perspective. Our philosophy has always been to hire strong people and be surrounded by people who are better than you, that can lift you. When things are not going so well, they're still positive. And I'm blessed to say that I'm surrounded by a team of amazing individuals who do amazing things and are very good at what they do. And in Little Oxnard, we've been able to build a very significant multi-specialty practice where we have multiple specialists who come to our office. We have an anesthesiologist who, like a lot of patients, don't like to be awake. So we have an anesthesiologist who helps us treat those types of patients. And we have a world-class dental laboratory where we can custom finish everything for a patient, and we can have it exactly how they want it.
Which is the challenge with many private practices, right?
Yeah.
Having everything and not everything in one place, the technology, etc. So before we get into basically Anacapa, what you guys do here, the marketing sales side of it, and just the customer side of it, at the point that you were done with your degrees, okay, and then you were teaching, right? When did you kind of start thinking, hey, the entrepreneur route, the private practice route, this is something I want to explore. I'm being called to this vision. How did that kind of transpire? Was it always known in the back of your head, or did it slowly
That's a great question. I loved academics, and I'll always be in academics to some degree. However, I needed a new challenge.
Yeah.
And I wanted to see if I could translate what I'd learned in academics into a private practice setting. Academics requires a different set of skills,
right,
and private practice requires a different set of skills. Now, when we're at dental school, nobody teaches you about business. So you could be the best dentist in the world, but not know how to run a business, in which case your business closes down after a few years.
Have you seen that with a lot of your peers?
I've seen quite a few struggle. And a lot of my colleagues, certainly in this area, are insurance-based. And insurance reimbursements for dental care are not great. And it doesn't allow the dentist to do really high-quality work. Now imagine somebody's working in your mouth. You have a specific insurance that sends you to a specific dentist, and the dentist gets a specific fee. So they can't afford to use labs that are high-end.
Right.
They can't afford to spend the time because they've got staff to pay and all of that kind of thing. So from a patient perspective, they don't know that. Right. So imagine we fix 3 teeth and we don't fix them properly, and you end up losing them.
Right.
It's significant.
Right.
So I'd say choosing the right dentist is very important in terms of not just aesthetics, but in terms of function and longevity of health. Because if you don't have any teeth, you can't chew very well. And if you can't chew very well, you're
Yeah.
not going to be doing so well in a few years.
Yeah. Well, and I know you in one of your videos, just doing a little bit more research, you talk about how, there's the implant markets, but then there's the, I guess, re-implant market, right? Or I don't know exactly what you call it, but those who basically are, they go to a dentist first, they don't do a great job, and then they have messed up teeth, and now they've got to find another dentist who will repair.
Mm.
So that's a whole market because of some of the things you're talking about. So at the point that you decided to jump into your private practice, okay, you went all in. Talk about those. Let's go back to those early years of when you started Anacapa, and things maybe weren't going as planned. I don't know, it was the first 3 months or 6 months or a year, and you were starting to go think about, hey, did I make the right decision? And can you talk about that and just kind of what made you push through?
All right. So when I first started, I thought I'm a specialist. I was chairman of restorative dentistry at USC School of Dentistry, and I thought coming with somewhat of a reputation, dentists in the area are going to refer to me and I'm going to be inundated with patients. And the first few months were scary. It was at a point where I was not even meeting my overhead. I was taking money out of savings and trying to pay for the business, and nobody likes that. So I looked into marketing, and I decided that I'm going to start educating patients, and I'm going to educate them in a way they understand, in the language that they understand. So the first thing I did is I did do full-page ads in the Ventura County Star. And what little money I had left over at the end of the month, I just advertised. But when you advertise, you have to be able to deliver, and you have to have that customer service. So I sent my staff to Four Seasons training, Ritz-Carlton training, how to manage conflicts and how to answer the phone. So I had to have that infrastructure in place. And my first ad, I still remember, I had the first patient came in and needed a full mouth of teeth. And that's, significant treatment for the patient. And it certainly, paid our bills for sure. And it went from strength to strength. And my ads were greater frequency, and I explored different marketing channels and avenues just to get the word out there. Right. Because the reality was there are many dentists in the area, but there weren't many prosthodontists. And if you ask an average person what's a prosthodontist, they will never be able to tell you. So I needed to get the word out.
Yeah, 100%. And you started, right? And I think that's the key. I think in marketing, sometimes people are looking for the perfect strategy, but sometimes it's getting messy first, right? Starting with something, testing and tweaking, adjusting, right? And then, of course, incorporating other channels. Talk at a high level. Let's get into it now, because I think a lot of into the marketing stuff. I think a lot of entrepreneurs, I think when they first start out, they think, like you said, you're going to get a ton of referrals, and referrals are hard to get, right? They're hard to get. You have to do the work first, right?
Yep.
And do it impeccably, right? So, talk a little bit about how now you've gotten the referrals, right? You get a ton of referrals now, just because of the quality of work you do. Talk about kind of that referral system and how you guys get it now versus early on when you just started.
So I will say, marketing brings you patients. When patients walk through the door, they have to be treated well, and you have to deliver what you promised that you're going to deliver.
Right.
And once you do that, those patients remember you. And we get a lot of referrals from existing patients, which are the best type of referral, because they come in knowing what their friend, aunt, mother went through, and it's easy because the patient's happy already at the outset, and we pay attention to detail, and we're able to provide them with high quality dental treatment. Now, existing patient referrals are important, but I still feel external marketing has a huge role in patient education. Not just the internet, not just the newspaper, but social media today is a quick way to get out a lot of information. And there can be a lot of false information on social media too. you'd alluded to in the past, like the implant dentistry market is a hot market in the dental world. However, the failing implant market is also a hot market because these implants are not done well. Now, as a patient, when you're looking at these social media ads, you don't know who to choose. You don't know what criteria to look at and whom you should go to. Are they going to do a good job? How much experience have they had? How many patients have they treated? Can I speak to some of their patients? These are all things that, as a patient, you should be looking for. Whenever you research anybody dental or anybody medical and you're going in for a significant procedure, you owe it to yourself to do your background work and your due diligence before you decide to go with a specific person.
Yeah. Yeah. I mean, and nowadays with you talked about social media. Yeah. I mean, there's dentists across the country who have huge followings, but what they're doing is they're focused on volume. I mean, I've seen dentists who every day they're doing a dance with their staff, right? And tracks the followers, right? Like literally dances to top 40 songs, right?
Yes,
I don't know if you've seen that, and I'm thinking, what has this world come to where professionals are doing that, and it clouds, I would say, experts like you who really know what they're doing, right? And so maybe it draws people in, but maybe not the right clients, right?
Correct.
So I know you're big on that. Talk a little bit about the ideal client and marketing, basically attracting, everything versus your ideal client, and how you've been able to kind of narrow in on that.
So marketing is the message.
Yep.
Marketing is the education. Now, if you are marketing, definitely your infrastructure has to be set appropriately. For example, the phone has to be answered correctly.
Right.
Our phone concierges have to have empathy. They have to be able to answer patient questions. They have to be able to direct the patient. So from a perspective of marketing per se, you're right, it's a test. And as soon as the patient comes in, the customer experience has to be second to none. We bend over backwards to try and exceed the patient's expectations, try to give them added value from what they would expect from any dental office. So when they come in, and even if they should decide for some reason or another that they can't proceed with the dental treatment right now, hopefully they'll remember their experience, and maybe in a year or 2 or 3, they come back. And we see that quite often, because the reality is dental treatment done well is costly.
Right.
And it's a significant burden on somebody who's having extensive dental treatment done. But there are ways that we try to split it up with them. And we see many of these patients, they show up, they come in, they love us, and then they say, you know what, it's not the right time yet, but I'm going to be back. And lo and behold, 2-3 years later, they're back to the door and we get going.
Right. 100%. And I know, my experience just from the first time that I walked in here, like even as a non-patient, just a bystander walking in, you can tell the ambiance from the paint to the logo to the lighting to the way that all your staff act. And I'm not just saying this, I'm being very transparent. The way that your staff actually answers the phones, like you can tell they're well trained, right? And it sounds like you've got a pretty high standard on that, and you keep up with that standard. So, and if not, then perhaps folks aren't gonna cut it here. So, talk a little bit about basically all the channels that you're doing right now in marketing. You're doing the social media, your Facebook, your search, your print advertising. Talk about kind of the wide breadth of what you're doing and how you kind of decide and evaluate.
So marketing has to be repetitive. If you look at marketing strategies, they say that it takes a prospective person to look at an ad 7 times before they decide to pick up the phone.
Right.
So we do newspaper ads, and all the ads are education based to try and give the patient an idea of what they are likely to expect, what questions they should ask. We do internet-based SEO, pay-per-click. We do social media ads. We advertise on TV. We've done radio. We've done pretty much everything.
You're still doing TV, and it works.
Streaming.
Okay, it's streaming. Okay.
And the reason we do it is to get the message out there.
Yeah.
Somebody sees a TV ad and then they open the Ventura County Star and they see a full picture. Say, you know, I saw that yesterday.
Right.
And they say, you know, let's try them. Let's see what they're like. And so should they decide to pick up the phone and call us, now we have to deliver what we said we we're going to deliver in terms of customer service, dental treatment, aftercare, and essentially have everything lined up. So once again, the patient's experience is phenomenal.
Right. One of the things that that I noticed about you, you're one of the first, I would say, entrepreneurs, I would say, in this area, and also even just dentists that I've known who've actually even talked about PR, right? Earned media. So you've done a lot in that game. Talk a little bit about PR and the difference between that, how that incorporates in your kind of marketing philosophy.
So PR per se is once again just get the message out. As I mentioned, there are hundreds of dentists in Ventura County, but not many prosthodontists. And everyday patient comes, what is a prosthodontist? And as I said, the average person doesn't know what a prosthodontist does. So from a PR perspective, we had to get that message out. What does a prosthodontist do? Describe it in terms that patients can understand. So for example, we are specialists in cosmetic and implant dentistry, but the regular person would not know that.
Right.
We are specialists in digital technologies and fabricating dentures, but the regular person wouldn't know that. Prosthodontists are trained to actually complete laboratory work themselves, which gives them a greater understanding in terms of what to do when they're working in the patient's mouth. Patients don't know that, right? So PR is used from a perspective of really educating the patient in regards to what services we provide. Now, at Anacapa, I'm not the only specialist. We have periodontists who are gum specialists. We have endodontists that are root canal specialists. We have oral surgeons. We have anesthesiologists who put you to sleep and you wake up and your dental treatment is done. And I'm a big believer in specialty care. If we've gone to the extent of high-end customer service, we have to deliver with high-end dentistry. And I really don't believe that one person can be good at everything.
Right.
You have your niche, you have the area of expertise, and it's good to call upon other specialists and say, hey, I really need you to take care of this area. And the advantage of everybody being on site is that we are working shoulder by shoulder and providing the patient with the best care. The patient doesn't have to go from one office to another, deal with two different specialists and two different financial coordinators and two different phone calls confirming appointments. Everything is done on site. And I'm proud of that. We've gone from a very small practice to a practice which I think is, and I'm a little bit biased here, second to none in Ventura County in terms of the services and the technology that we provide patients.
Right, 100%. And we're gonna transition just a sec, just to kind of the future going forward, and what are the thoughts with Anacapa going forward, what you guys plan to do. But real quick, back to some of the other marketing principles which I've heard you talk about, is direct response marketing, right? And again, there's not many dentists who are as schooled about marketing principles as you are, and I really, that's a compliment to you. And I've learned a lot from you. So talk a little bit about direct response marketing, what your philosophy on that is, and how either that's changed or that's evolved over time in the last, I would say, 10 to 15 years with the digital space.
So I'm going to say patients have to see the same message multiple times.
Yep.
Patients also, they're not buying teeth. They're buying a lifestyle. I give an example. If I said to you, I'm going to pull out your front tooth, you have to walk around the whole year, and I'm going to give you $5,000, would you do it?
Probably not.
What if I give you $10,000?
No.
What if I give you $50,000? You can't walk around with anything without your front tooth.
50,000 maybe.
Without your front tooth. You go everywhere without a front tooth.
Probably.
For a whole year.
I don't know. Yeah, still no. That's still a
Right?
no.
So
Yeah.
in 2 minutes, I built the value of your tooth to
Right.
$50,000. And it wasn't about the money. It was just the fact that you'd be embarrassed walking around
Yeah.
without a front tooth.
Right.
How would you socialize? How would you get a new job? How would you go on a date? You're married, so you can't go on a date. So
My wife wouldn't kiss me.
So how would you do all of those things?
Yeah.
So when patients come to see us, it's a big deal. It's a big deal. And they're looking at how their life is going to change, how their confidence is going to change. What are they going to be able to eat? They can have a healthier lifestyle. They're going to live longer. They'll have, more intimate with their partners.
Right.
It's a huge deal, these teeth.
Right.
So patients are buying a lifestyle. They're not buying teeth. And I think as dentists, we have to understand that and convey that information to patients in a way that they understand.
Right. And really speak to those fears, those hurts and pains, which you do a great job at.
An unhealthy mouth is an unhealthy body.
Right.
There are links between gum disease, periodontal disease, and heart disease, and high blood pressure. There are links between, sleep apnea, which dentists would diagnose. Dentist would be the first person you'd see. And sleep apnea has many ramifications to patients' overall health. So the health of the mouth is a gateway to the health of the body.
Mm-hmm.
And a healthy mouth really equates to a healthy body. It's as simple as that.
Right. So let's talk about next 10 years, next 20 years. You've built, you've got a successful career in academia. You've built a successful private practice. I mean, you literally can continue just doing the same thing that you're doing and continue to thrive. What are the plans for the next 5 to 10 years, both professionally and personally?
All right. So part of what we do, as I said, we have a private teaching institute, and we have the practice, we have academia, we have a dental laboratory. And I find that over here, the cost of health, the cost of dental is prohibitive for many patients. And for me, it's sad that they don't have access to care.
When you say over here, you mean the U.S.?
In the U.S.
California? Okay.
So one of the objectives is definitely to give back. And we've started doing that. We choose a couple of prospective patients a year where we provide a full mouth reconstruction at no cost. And
you did that recently, right?
We did it recently, and
cancer patient.
We changed their life, right? And we don't want anything in return. This is just a way of giving back to the community and saying, okay, thank you so much for supporting our practice. I would love to do that on a bigger level through a non-profit. So when you ask me about what do the next 5-10 years hold, this practice will still keep growing and providing excellent care to the community. But the goal would be to provide patients who don't have access to care, patients like veterans who've served their country, patients who have suffered from diseases, and those types of patients who have absolutely no way to get dental treatment.
Right.
And to be able to provide them dental treatment and change their lives would be amazing. And how do we do that? We do this currently. We do this in different countries by educating dentists. Patients get treatment for free, so everybody wins, right? So we run training programs where we're training a dentist, for example, to place implants. We have a patient that comes in who needs implants. The dentist places the implants under supervision. The patient gets those implants for free, and everybody wins. The dentist gets training, and the patient gets dental implants. Mm-hmm. Imagine if we had veterans. I see many veterans. They come in, they've suffered from post-traumatic stress disorder, they're on medications, the teeth are breaking down, and we've got to do something for them.
Right.
We have to help them in some way. Now, do they have the VA hospital? They do, but the waiting lists are huge, and they never get the care that they deserve. Right? So trying to give back to the community, trying to give back to people who have helped us and enabled us to live the life we're living. That's my vision. That's what I want to do.
That's inspiring. That's 100% inspiring. And you're right. I mean, there's a ton of veterans. There's a ton of population out there that really needs that level of care. They'll never get it unless there's somebody like you who's willing to do that. So that's inspiring. Let's close out here with two questions. What is the number one marketing, I would say, lesson or piece of advice that you would give to an entrepreneur who's either starting or has a successful either practice, doesn't have to be a dental practice, could be, but is trying to grow it? And then we'll end off with our last question.
So one piece of marketing advice that I would give is start yesterday.
Okay.
And make it a good educational piece. In healthcare, we're not really selling, we're educating.
Mm-hmm.
And the more the patient knows, the better they're able to make a decision. Right? When I was in the UK, marketing was forbidden. We couldn't advertise as dentists.
Mm.
If you advertise, they think you're a bad dentist. Why does he need to advertise? But today, we have to get that message out.
Right.
And we have to educate the public. So look at marketing as a tool to bring the patient's dental IQ to another level so that they can ask the right questions and be able to get the right treatment from the right provider.
Mm. That's great. Last question is what is the basically the one piece of advice personally that you would give to entrepreneurs actually going through their journey?
I would tell you, if anybody tells you that you can't do it, make it happen.
Okay.
Right? Whatever obstacle comes in your way, find a way. If something's in front of you, go to the side. If it comes to the side, go over the top. Don't create an excuse for yourself.
Mm.
Because if you create an excuse for yourself, you're going to believe it and you're going to give up. Right? Being an entrepreneur is a different set of challenges every single day, whether they be financial, people challenges, facility challenges. You have to be a problem solver and you have to be a can-do person. And you have to be able to get over objections, get over obstacles, and keep your eye on the end goal.
Mm. Wow. Inspiring. Thank you so much,
Thank
Doctor. I really appreciate
Thank
it.
you.
I admire you
Thank
and
you so much.
inspired by you, and I know our audience will certainly benefit from this interview. So thank you so much.
Thank you so much.